In this video, we'll talk about neurotransmitters and the associated neurological disorders and most commonly used drugs to treat such conditions and in terms of whether they act as agonists or antagonists. Now, if you look at this table, the first column is about neurotransmitters. So the first one is GABA, and the second column is the disorder associated with this specific neurotransmitter. The third one is the commonly used chemical or drug for that particular condition. And the last one is the way the chemical acts. You'll also notice in the neurotransmitter column, there is a negative sign. These signs indicate the abundance or lack of the specific neurotransmitters. A negative sign means that that particular neurotransmitter is deficient associated with a specific disorder. Okay, I hope the organization of the table makes sense. Let's move on. GABA neurotransmitter, decreased availability of this particular neurotransmitter leads to anxiety. The common chemical that's used is the anti-anxiety medicines Valium. The way Valium works is it acts as a GABA agonist. Remember, anxiety is because of lack of sufficient GABA. What is this chemical doing is it's acting as an agonist, meaning it will increase the availability of GABA. The main function of an agonist is to increase the availability of specific neurotransmitter. They can either act as neurotransmitters themselves, or they can somehow increase specific neurotransmitters' presence in synaptic cleft. We'll talk about one such example here in a second. If you look at the second neurotransmitter, the norepinephrine, decreased amount of it is often associated with depressive symptoms. Several antidepressants are used where antidepressants act as a norepinephrine agonist. Depression associated with decreased amounts of serotonin. In that situation, we use serotonin agonists to increase the availability of serotonin. Here is the thing I was referring to. There are different ways agonists act. In this case, where the depressive symptoms are because of lack of enough serotonin, a specific antidepressant called SSRI are used. SSRI stands for selective serotonin reuptake inhibitor. If you remember, only few neurotransmitters in a given synaptic cleft get attached to the receptors on the postsynaptic neuron. And several things may happen to the remaining neurotransmitters. They either get degenerated, or they get deactivated, or they are just vanish or move away. Or one of the things we discussed was that the presynaptic neuron can reuptake, reabsorb these things and recycle. What SRI does is this. It inhibits the presynaptic neuron to reuptake serotonin so that there is more serotonin in the synaptic cleft, resulting in more availability of serotonin and thereby treating depression. That's why it's called selective serotonin reuptake inhibitor, inhibiting the reuptake of serotonin from the synapses. This table, you'll see the same format: neurotransmitters, it's positive, negative sign, the disorder associated with the chemical often used in this condition, and the way it works. So here, dopamine, excess of dopamine results in schizophrenia, and antipsychotic drugs are used with these conditions. Antipsychotic drugs act as antagonists. Excess of dopamine in certain parts lead to schizophrenic typical symptoms, including hallucinations and delusions. So what antipsychotic drug does is it blocks dopamine receptors in the synapses, especially on the postsynaptic neuron, thereby making dopamine less available and thereby decreasing symptoms of hallucination. And the opposite condition of this is a decreased amount of dopamine, which results in Parkinson's disease. There is irregular movements of different muscles, especially fine motor movements are lost in this individual. And the reason why we don't have chemical action here is that the reason why you see Parkinson's condition is not because there is dopamine and it is not available readily, but because the cells that produce dopamine in specific parts of the brain are dead. Acetylcholine is another neurotransmitter, and lack of it associated with Alzheimer's disease. One last thing, information about the specific actions of some important neurotransmitters. that naturally occur in our body. For example, dopamine, we have seen increase or decrease the amount of dopamine in the system due to several disorders. But dopamine itself, naturally, its role is giving a feeling of pleasure. Chemical equivalent dopamine agonists include such chemicals as amphetamine, cocaine, opiates, alcohol. All these things mimic the action of dopamine, thereby acting as agonists and giving you the feeling. But here's the good news. There's another thing that actually gives a similar feeling of euphoria, uh, love. Now, glutamate. Glutamate is a neurotransmitter. It increases the activity in general of the nervous system. The caffeine is an example for a chemical that mimics a glutamate, and it increases the neural activity. That's why people take caffeine to be active, because it acts as stimulant. The last one is endorphins. These are called endorphins because these are endogenously available morphines in our body. These are the morphines that our body produces. Endorphins act as painkillers, give us euphoric feeling of pleasure. Endorphins are usually increased in our body when you do strenuous exercise, especially if you are a runner. The feelings of pleasure and well-being after a long run are because of endorphins. Now, chemical equivalents of endorphins include morphine, heroin, and narcotics. Again, these chemicals act as endorphin agonists. In the next video, we'll talk about brain and nervous system.